Hi, this is John Adamson, the Rehab Documentation Guru, and today we're going to talk about the term activity tolerance. You've also seen functional endurance, and perhaps you've documented these things, but I'm going to tell you that in general, the term activity tolerance, whether it be goals that you're working on or you're documenting that you're working on activity tolerance, basically means nothing in terms of skill. And let me explain. In general, working on general activity tolerance is considered by Medicare working on exercises that promote general conditioning. And in their regulations, Medicare specifically stipulates that they do not pay for general conditioning. Some electronic medical records, or EMR, actually does use this phrase of activity tolerance for assessment and/or goals, and that's a problem. And one thing we need to keep in mind is that just because electronic medical records has starter phrases does not mean that those are the best phrases to use. And so we're going to talk about how to solve some of that problem. For more details on this, please feel free to check out my course offerings. One which covers in some detail about this is my course on Documentation Bootcamp offered through Summit Professional Education. And I just presented one down in North Carolina and getting ready to do another one tomorrow. So anyway, let's look at some phrases that typical electronic medical records can have for activity tolerance. Here's a goal that I've seen. Patient will tolerate 30 minutes of graded therapeutic exercises. That might be an example of one. Here's another one. Patient will tolerate standing for 10 minutes in order to. And then here's a basic assessment statement. Patient has poor activity tolerance, limiting whatever that might be functionally. And to those things, I just have to say, what? What does that even mean? There's really not anything specifically measured by those phrases. And one of the things that you probably have learned at some point, or if you've attended my course, we talk about SMART goals. SMART goals being specific and measurable to start off with. And in order to do treatment, you also have to be treating specific and measurable things. And by itself, activity tolerance does not have a measurement associated with it. So let's talk about making it better. So here's some examples. One thing we can consider is, rather than activity tolerance, we can consider what's limiting the patient's activity in the first place, and these would be called underlying impairments. So for example, does the patient have cardiopulmonary limitations that require training in endurance to prevent abnormal responses cardiopulmonary-wise? Could the patient's activity tolerance be limited by pain, so that maybe our treatment should address pain that limits activity so that the patient can perform activity with no or limited pain? Is the activity tolerance maybe related to a patient's inability to cope with sensory processing because they have sensory processing issues that prevent them from being able to complete a function? Perhaps a patient's activity tolerance is limited because they have attention span disorders. So these would be the underlying impairment issues that we can maybe measure that are impacting activity tolerance to make meaning of this phrase. So in other words, what is the activity tolerance limiter or underlying impairments? The things that we learned to measure back in the day called school that we are skilled to do. Here's some examples of how we can fix the phrases we saw on the first slide. So for example, rather than saying patient will tolerate 30 minutes of graded therapeutic exercise, what if we had something like this? So here's an example. Patient will complete standing sink side shaving and grooming while maintaining heart rate less than 80% of their predicted max and no rest breaks, demonstrating safe cardiac response to activity. So this actually means something, and it's a demonstration of skill from the standpoint that you as a therapist need to be able to monitor the patient's heart rate response. How about this statement? Rather than saying patient will tolerate standing for 10 minutes in order to, how about something like this? Patient will have reduced pain, right knee to less than or equal to 3 out of 10, to allow standing at stovetop to cook breakfast without interruption. That's an improvement of activity tolerance, but in this case it means something. It's objectively measured, it's related to an underlying impairment and a specific functional outcome. Here's an example. Rather than saying patient has poor activity tolerance limiting blank, and again this is too broad, not specific enough, what about this? Patient's work and breathing is 6 out of 10 and higher on rate of perceived exertion scale during phrase level utterances, indicating insufficient breath support for conversation. Anyway, that concludes my examples. I may do a future video on this same topic, but as you can see, by itself, activity tolerance is not generally acceptable. And when you talk about activity tolerance, again, working on it is not skilled. But there are underlying impairments behind activity tolerance that we as therapists can work on that demonstrate our skill and therefore become something we can bill for. Again, my name is John Adamson, the Rehab Documentation Guru. If you have any suggestions for future videos, please feel free to put that in the comments section. As always, I invite you to subscribe to my channel, and I will be posting content on a regular basis. Thank you so much for your time. Have a great day.